The SpiroUSB spirometer plugs directly into the USB port of your PC without the need for any additional docking station or data uploading. Using a laptop or notebook with the SpiroUSB allows complete portability, enabling it to be used in a range of clinical and field-based settings. The SpiroUSB is supplied complete with Spirometry PC software. Designed for the professional, Spirometry PC software allows baseline and post-bronchodilator force spirometry maneuvers to be performed with a choice of predicted values, interpretive algorithms, quality assessment of each maneuver. A powerful database allows patient search facilities, trending of results, reporting and data sharing with your electronic health record, or EHR, and other PFT systems in the CareFusion family, including VMAX and Sentry Suite software. Thank you for taking the time to watch this CareFusion respiratory diagnostics instruction video for the Micromedical Spirometry PC software. This presentation will demonstrate the initial software setup as well as the preparations required before performing real measurements. As with most pulmonary function measurements, coaching a patient through the testing maneuver the correct way is very important, since it's one of the main influencing factors for good quality data outcomes. Hence, in this e-training module, we'll be showing you how to correctly instruct the person performing the breathing maneuvers. Please choose a topic or press the arrow key to continue in the prescribed order. The Spirometry PC software, SPCS, is supplied in a white cardboard box. Inside the box, you'll find a CD for installation, which needs to be placed in the CD drive of your PC, a small white carton containing the SPCS dongle, quick start guide manual, and unit to PC connection cables, both USB and RS-232 cables, depending on the model and connection mode of your micromedical spirometer. Insert the Spirometry PC software CD in the CD drive on the computer, and installation will start automatically. You'll be prompted to enter the serial number of your SPC software, as well as your name and company or practice details. After the software has been installed, a customization wizard will guide you through the initial customization of the software for any preferences you may have regarding functionality. Once installed, the software is accessed by inserting the dongle key supplied into a free USB port on your PC. The software can be installed on multiple computers. However, to access the SPCS program, the dongle will need to be inserted in a free USB port on the PC you intend to use. After installation, the software will open, with the example database available to review and look at patients in the example database. We recommend that you create your own database prior to performing any tests. To create a database of your patients, click on the File tab in the top left-hand corner of the toolbar and select New Database. You'll need to provide a name for your database. Each time you open the Spirometry PC software, your new database will automatically open to enable you to perform tests on or add patients to the database. Prior to using the SPCS software, it's strongly recommended that it's customized to your preferences. To customize the unit, click on either the Customize option on the main menu or the Customize tab, which is one of the 6 tabs running along the top of the main screen. Selecting the Customize tabs provides a list of customization options, beginning with Select Region and ending with Change Password. You'll find the same options in the main menu if you click on Menu Customize. During installation, the geographical region will be displayed. Alternatively, during customization, select the option Select Region. As a consequence, the regional settings screen will be displayed. This screen allows you to select the region and language settings. By clicking on the drop-down menu, a list of languages and countries will be displayed. By selecting a specific country from the list, the software will automatically default to the language, date, and time format and height and weight units typical for your country. You can select the defaulted country-specific requirements by clicking on a country in the map. However, any of these along with the language can be customized and changed according to your own personal preferences. The General Settings option allows you to select the height and weight units. Please note here, these general settings will automatically have been set when the country selection was made from the world map. However, this option allows you to change them according to any specific preferences users may have. The print settings allows the page width to be defined. The print report can also be customized to include the hospital or doctor's practice name and address by filling in the title and description lines. Ticking the box to automatically export a report to PDF will automatically cause each report to be exported to a predefined folder. This can be selected by clicking Browse and choosing the destination folder. The PDF option easily allows spirometry reports to be easily added to patients' records in EMR systems. There are individual print options for spirometry and MVV measurements. 4 predefined print settings are available: Basic, Intermediate, and Advanced. They include the graphs to be printed, physician's signature line, and other requirements for the printed report. The report can be completely customized to the user's individual needs by selecting Custom from the options and changing the settings. The Spirometry Settings option allows settings to be made specific to spirometry. There are preset configurations according to the ATS-ERS 2005 guidelines, ATS-ERS 2005 without short blow warning, UK BTS NICE settings, UK BTS NICE settings, and also the option to customize to your own requirements. Selecting either ATS, ERS, or BTS will predefine the requirements for spirometry for both of these standards. The settings here will determine how the software calculates the spirometry results and how it displays the graphical information on screen. For example, the flow, volume, and volume time graphs can be displayed with a grid behind them if requested, or can be displayed blank. There is an option to choose how to calculate the best blow from the results based on an individual indice or based on the highest indice from each blow, to give a collective best report termed individual best, where the highest indice is chosen irrespective of the blow it was obtained from. There's an option to set a calibration reminder prior to any test, the choice of trending results on a chosen indice, as well as the option to set the incentive criteria based on the first and subsequent tests to ensure the incentive is set to achieve the target criteria. The spirometry indices for both relaxed and forced maneuvers are listed for the user to decide which of them should be displayed in the software and printed on the report. Clicking on the corresponding box tick will generate a tick that confirms that the chosen indice will be included. It is entirely up to the user to decide the number of indices to include. It's important to note that all indices are calculated, which makes it possible to return to the indices setting after a test and increase the number of indices displayed and reported. Once the selection has been made, it should be saved. The MVV settings and indices selection options are the same as for spirometry, but are specific to the MVV test. The reproducibility criteria of acceptable maneuvers, the number of post-tests to be performed, and the predicted value default set can be chosen from the MVV settings, and allow the user to select the indices they'd like displayed and reported for the MVV maneuver. Clicking on the corresponding box will generate a tick that confirms that the chosen indice will be included. Once the selection has been completed, it should be saved. The device configuration option allows the micro-DL device to be programmed with patient-specific traffic light options based on percentage of predicted or personal best values. The Today List option is a useful feature, enabling patients to be selected from the database and downloaded into the MicroLab or MicroLoop MK8 touchscreen spirometers. To select a patient, simply select the patient from the list in the database shown. You may download as many patients as you wish. When the list of patients is complete, select Download and it'll be downloaded to the spirometer. To view the list in the spirometer, simply select Patients and then Today, and those patients downloaded will be listed. Note here that only patient demographics are downloaded to the unit. This is a useful feature to avoid having to enter patients' details into the spirometer if they've already been entered into the SPCS software, and if a specific group of patients is to be tested for a clinic. The ability to manage and delete patients in the Spirometry PC software database can be password protected if required. The default password is 0000, but the user can change and personalize it. Please note the following important point. If the default password is changed, then it's the user's responsibility to keep a record of the new password. CareFusion can't provide reminders or a means of changing a new password. The SpiroUSB spirometer is supplied in a white cardboard box. The box also contains 2 multi-language manuals. The SpiroUSB spirometer and all necessary accessories are supplied in a hard shell carrying case. Inside the case you'll find the SpiroUSB desk stand, the turbine transducer, a USB extension cable which can be used if the computer isn't near the patient, and a set of disposable one-way mouthpieces and nose clip. To connect the SpiroUSB to the PC, simply plug the USB connection on the end of the head assembly cable into a free USB port on the PC. A blue light will illuminate on the SpiroUSB transducer to indicate that it's recognized by the computer and the USB drivers have installed automatically with the Spirometry PC software. The MicroLab, MicroLoop and SpiroUSB can all be connected for live blow measurements to the PC using the USB cable supplied. Ensure that the MicroLab and MicroLoop are switched on and the main menu is displayed on the screen. We also recommend that the battery is fully charged on the devices or the main supply is connected. The SpiroUSB requires no external power, and when connected to the PC, the blue light on the transducer will be illuminated, showing it is powered correctly. The recommended procedure is to enter the patient's details into the database prior to performing a test. To add a patient to the database, click on the New Patient icon, then enter the patient's details into the fields as shown. Fields marked with a red asterisk are mandatory and are necessary to obtain predicted values for the patient's spirometry. During customization, the default predicted value will have been selected. To change the predicted set for a specific patient, touch the drop-down menu arrow beside the predicted set and then click on the new predicted set you'd like to use. Factor, percentage, allows the predicted values to be increased or decreased for patients of various ethnic origins. The current ERS guidelines recommend the following reductions when testing individuals using the ECCS predicted value set. Hong Kong Chinese, 100%. As per Caucasian individuals. Japanese American, 11% reduction. Polynesians, 10% reduction. North Indians and Pakistanis, 10% reduction. South Indians and those of African descent, 13% reduction. So, if entering the details for a patient of African descent against the ECCS predicted values, the factor should read 87, causing a 13% reduction. Prior to performing spirometry tests, patients should be advised in advance to avoid certain activities to ensure optimal test results. Prior to attending a spirometry test, the patient should be advised not to smoke within at least 1 hour of the test, not to consume alcohol within 4 hours of testing, not engage in vigorous exercise within 30 minutes of testing, nor eat a large meal within 2 hours before the test. The current ATS ERS 2005 guidelines give the following advice on contraindications for performing spirometry. Patients should not be tested within 1 month of myocardial infarction. Suboptimal spirometry results are likely in individuals suffering from chest or abdominal pain, oral or facial pain exacerbated by a mouthpiece, stress incontinence, dementia, or individuals in a state of confusion. If you need to enter a patient's details or recall a patient from the spirometer database, please ensure his or her demographic details are correct prior to commencing testing. The patient should be in a relaxed state. Note the patient's medication and make sure that any tight items of clothing are loosened or removed. We recommend using a microguard filter for each patient tested and then disposing of it after the test. Microguard filters have a 99.99% bacterial and viral efficacy and should be used as part of spirometry hygiene and cross-contamination procedures. Microguard filters can be connected directly to the turbine. Alternatively, if a disposable cardboard mouthpiece is used, the adapter supplied with the Micro 1 should be wiped with a disinfection cloth after each patient test. CareFusion can supply filters with a round mouthpiece or an oval one with teeth marks. Filters can be supplied on their own or with a nose clip in a single patient-use disposable set. To perform a relaxed spirometry test, select the tab Perform Test and click the button New Exam. In the dialog box, select the option Spirometry and then click on the button Relaxed Base. The empty flow volume and flow time charts are displayed and recording will start as soon as the patient starts blowing. With the patient seated, ask him or her to place a nose clip on her or his nose and the microguard filter or mouthpiece into the mouth. Make sure the teeth are firmly positioned on the housing or mouthpiece and the lips form a tight seal. If tidal breathing isn't required, then instruct the patient to inhale fully to TLC and then exhale at a sustained and comfortable speed to measure expiratory vital capacity. The display will show a volume time graph and also a volume bar of the maneuver. Now let's demonstrate in detail how the patient should be instructed using the expiratory reserve volume maneuver.
So deep breath in and blow. Keep going, keep going, keep going, keep going, keep going, keep going, and then relax. Good.
Neither maneuver should be forcibly exhaled and should be performed at a sustained and comfortable speed. To repeat a test, select again. When you've completed the tests, select Accept and Done. To perform a forced spirometry test, select the tab Perform Test and click the button New Exam. In the dialog box, select the option Spirometry and click on the button Forced Base. The empty flow volume and flow time charts are displayed and recording will start as soon as the patient starts blowing. With the patient seated, ask him or her to place a nose clip on the nose and the microguard filter or mouthpiece into his or her mouth, making sure that the teeth are firmly positioned on the housing or mouthpiece and that the lips form a tight seal. Now ask the patient to perform a maximum inhalation as fast as possible and then exhale as hard and as fast as possible, until she or he can exhale no further. Maximum encouragement should be offered to patients when performing these maneuvers so as to ensure they put everything they've got into it. Now let's demonstrate in detail how the patient should be instructed during the flow volume loop maneuver.
When you're ready, big breath in, really big. Blow hard. Keep going, more. Big breath in. Good. And relax.
To repeat the test, select again. When you've completed the tests, select Done. A minimum of 3 acceptable good blows are required to fulfill the quality criteria. If a patient has been tested on a previous occasion and now requires a post-test to be performed, you'll need to select the patient from the database. A list of dates showing when spirometry was performed will be displayed. To perform a post-bronchodilator test with the patient that's currently selected, touch the relaxed or forced post-1 icon.
Blow it hard. Keep going.
Repeat the test as previously described for either relaxed or forced spirometry. To perform an MVV test on a patient, either click on New Patient to select him or her from the database, or elect New Examination if the patient's already been selected. Select the MVV icon and a dialog box will appear containing the patient's height and weight. Details can be amended and also added, such as the choice of predicted values for the MVV test and also the patient's current medication and who they were referred by. With the patient seated, instruct them to place a nose clip on the nose and the microguard filter or mouthpiece into his or her mouth, with the teeth on the housing or mouthpiece and the lips pressed tightly around it to form a good seal. The patient should now be asked to tidally breathe for at least 3 breaths. When 3 stable tidal breaths have been detected, a vertical line will appear on the graph. You should then click on the button to start detecting MVV breathing and immediately instruct the patient to start heavy, rapid tidal breathing. The display will show the breathing cycle line in green to indicate the completion of the 12-second test. The MVV in liters per minute will be displayed, along with the breath rate shown in red or green, dependent on whether the test maneuver was acceptable. Press again to repeat the test. The test can be stopped once the ATS-ERS reproducibility criteria has been met. Now, I'd like you to start tidally breathing in and out. In and out. In and out. When you hear a beep and I raise my hand, start breathing rapidly in and out and keep going until I tell you to stop. It's crucial that you keep breathing in and out as fast as you can.
Until I tell you to start. Now. Good. Good. You've got 5 seconds. 5 more. Good. Keep going. Keep going. Okay. And stop. Good. You can stop. Perfect. Well done.
Now we're going to perform multiple maneuvers, so after each test, have a rest, and then we'll repeat it when you're ready to do it again. The current ATS-ERS guidelines recommend that spirometry calibration checks are performed on a daily basis using a 3-litre syringe. It's important that records are kept of calibration checks performed on the spirometer, including the date, spirometer serial number, and the pass value. Connect the syringe adapter to the syringe and connect the spirometer transducer and housing as shown in the picture. Upon choosing calibration verification, the user should enter their name and using the drop-down list choose the size of the calibration syringe they're using. Using SPCS software, calibration verification can be performed in either simple mode with a single flow rate or ATS-ERS mode at 3 flow rates. Both modes allow the option to perform expiratory or expiratory and inspiratory verification. If ATS-ERS verification is chosen, the display will show 2 colored bands. These are for guidance as to the speed the syringe should be emptied and filled. Select Start Test and, as instructed on the screen, fill the syringe by drawing the plunger out, and then empty the syringe by pushing the plunger in. When emptying and filling the syringe, the maneuver should be performed at a smooth, sustained speed, taking care to avoid slowing down or stopping during the maneuver. For this demo, expiratory verification is chosen, and therefore the airflow is recorded when emptying the syringe. If the maneuver has a pass status, then you can either repeat the maneuver in the current band by selecting Start Test, or choose to move to the next band. If you choose to move to the next band, then the result screen will show the skipped message to show you've moved without continuing to perform 3 maneuvers in a given flow rate. The screen will show a pass or fail status for each maneuver performed. The spirometer should pass on each flow rate. The calibration history can be viewed for the spirometer by selecting View History. This will show the name of the person who performed the calibration verification, the date, time, and the calibration status for each test. If 3 maneuvers have been performed, simply select Exit the calibration screen. By selecting Print Report, a printed report of the current calibration will be available for printing and storage. As you've noticed, coaching patients to perform the maneuver correctly is very important to ensure good quality results. The American Thoracic Society and the European Respiratory Society have clear guidelines on how to perform spirometry testing. It's recommended that operators familiarize themselves thoroughly with these guidelines. And you should note that in some cases, local guidelines might apply. Now, we hope you found this CareFusion training video useful. You may, of course, refer to it as often as you wish. Thanks for your attention.